So I'm talking about reflexology today. But I'm Tracey Smith, and I'm the head of reflexology support and research at the Association of Reflexologists. I'm also a practicing reflexologist for some 26 years. I'm not going to run through the bit on the bottom of this slide because you've seen it already through many of the talks. But before I start my talk, I'd really just like to put a bit of understanding about the world of complementary and alternative medicine. There was a report that was done in the year 2000, which is 23 years ago now, and that might seem a very long time, but actually in the world of complementary therapy, that's not such a long time ago. And that's the website address if you want to go and see it. And this report was on CAM, or complementary and alternative medicine, sort of the picture of that in the UK. It's a really interesting report if you want to go and have a look. But what it did was it defined 3 different categories, the big 5, and these are the professionally organized therapies, and you will already have heard about some of those. That's homeopathy, acupuncture, chiropractic, osteopathy, and herbalism, versus complementary therapies, which are the ones that can be done alongside medicine, versus alternative therapies. And alternative therapies are those that come from a different diagnostic paradigm, so they don't necessarily understand disease processing in the same way as we do in standard medicine. And they define those very specifically, and it's worth having a look. Now, the other thing you will have heard of already today was discussion about statutory regulation. So statutory regulation is where a therapy is regulated in statute, it's in law, it's been passed through Parliament, and unless you have a specific level of training and a specific level of ongoing professional development, you cannot call yourself that therapist. However, the government has very clearly said that they are not going to statutorily regulate any more therapies. This was said about 6 years ago. And so now what we have as complementary therapies, we have what's called voluntary regulation. And voluntary regulation, it means it is up to the individual to decide whether we want to pay the extra money and be regulated within an independent organization. In our case, in most of the category 3 therapies, that's under the Complementary and Natural Healthcare Council, or the CNHC. They have a website. They do have a listing of complementary therapists on that website, so you can go and have a look if you are looking for a therapist for one of your patients. So voluntary regulation is not exactly the same as statutory regulation, but all of the statutory regulators and the voluntary regulator CNHC all sit under the Professional Standards Authority, so they have the same umbrella body. So reflexology, definition of reflexology is, this is the World Reflexology Consortium. It's a therapy that's used worldwide as part of integrative healthcare. It uses techniques that apply pressure on reflex points mapped to the corresponding parts of the body, and reflexology helps to support the body's ability to function optimally. It doesn't make claims for specific conditions or anything like that. It's a touch therapy, and it's based on the theory that different parts of the feet, hands, face, or ears correspond with different areas of the body, and reflexologists work those points and areas. The fact that it's a touch therapy is quite important, because something that we've learned from the pandemic and from lockdown is the importance of human touch to our whole well-being, and that includes our mental health. And because of that definition from the House of Lords report, reflexology can be used safely alongside standard healthcare to promote better health, and is used that way, but only in a very small area, which I will discuss later. So the origins of reflexology, well, it's been used in the Far East for thousands of years. It is still used there as a part of the accepted self-care. They have big rooms of reflexologists, chairs down both sides. People come in, they all start at the same time, they all leave at the same time, and they get a cup of green tea and they go home. And that's just part of their self-care mechanisms. However, Western reflexology, which is the type you'll see mostly in the UK, arose from the work of an ear, nose and throat therapist back in the 1920s called William Fitzgerald. he came up with the idea that you could apply pressure to various parts of the body, and that would affect other parts of the body. Specifically, he started with, first of all, with numbness and pain relief by using things like elastic bands around the fingers or clothes pegs on the fingers. So his concept of using pressure to relieve pain was then picked up by his, some say apprentice, some say colleague, a woman called Eunice Ingham, who then applied the concept to applying pressure to the feet to see what that would do to the body. And she used very experiential methods. She probably had clients through her other side of her job, and so she was just looking at their feet and working on their feet and finding out what it was that related to what their illnesses were. And she came up with the foot map, like this one over my shoulder, that is used, very similar things are used throughout the world for all types of reflexology. So how does it work? Well, first of all, I'm going to talk about the science, because there's a very humanistic a part of reflexology, but we cover the science first. So there are two different types of skin on the body. There's the glabrous skin, which is non-hairy, and this is palm of hand, plant of foot. And I'm going to talk about the hand because obviously I have it handy, so to speak. And then on the back of the hand and up into the arm, and obviously on the back of the foot and up into the foot, there is something called non-glabrous skin, and that has slight hair on it, obviously more on some people than others. And that hairy skin has different nervous stimulation or nerve stimulation to that of the glabrous skin. So the glabrous skin has specific touch centers or mechanoreceptors, and they are very much stimulated by pressure and result in responses in the brain. They are responsible for our tactile ability, to the ability to feel even a tiny hair, for example. We can pick up a hair with our fingers because of those sensors. We can sense vibration through those sensors. And they are all part of something called both proprioception, which is the ability to know where your body is in space. And this is a very important part. It's almost known as the sixth sense, actually, in our bodies, to know where our body is at any time without actually being able to see it. We just know. That's proprioception. But they're also involved in interoception. And interoception is part of that sensing, regulating, interpreting signals within the body and integrating those signals that come from within the body. Proprioception is about external, interoception is about internal. And research has shown that by applying pressure, and this is very specific pressure, it's very point related pressure. Normally I do it with my thumb, but it's like, oh yeah, I can do it. It's very point related. This is the caterpillar walk, which is very often used in reflexology. So it's pressing specific points that that it has been shown that by mapping that to the brain, you can see that where I think as a reflexologist I'm working part of the body, that shows in the map to the brain that there is extra blood flow in that part of the body as well. So these blood flow changes may well be activating in interoceptive balancing. So we've got both proprioception and interoception working on this part of the skin. On this part of the skin, what's called the non-glabrous or hairy skin, it's different. So this has a specific nervous stimulation that's called the CT afferent cells or C-tactile afferent nervous system. And these nervous cells go straight to the brain. This is called affective touch. And it's activated specifically by skin to skin temperature slow stroking. Fast stroking doesn't do it. Very slow stroking doesn't do it. Different temperatures doesn't do it. So it is only activated by these slow skin to skin temperature stroking movements. Now, as a reflexologist, and also this is used in massage, that is known as effleurage. And so we have two different types of things going on here. We have the activation of the mechanoreceptors potentially, and we also have the activation of affective touch. Affective touch has been shown to be very much part of humanistic care, and it is believed to reduce the feelings of social exclusion and modulate pain, amongst other things, and also activate the interoception pathways. So in doing reflexology, the practical element of reflexology, we are probably, although this hasn't necessarily been totally proven by research yet, but there is some stuff going on with MRI scanning in America at the moment, probably activating those nervous cells that go straight to the brain, and then changes occur in the brain. So that's the science side of it. Then when we're looking at reflexology, we are looking at a very personalized side of things. So reflexology is very much aimed at people, not conditions. And that means that we are looking at the whole person. So for example, a person might have several different illnesses going on, but they also might have grief going on. They also might have anger going on. They might have problems with their family. All of this produces a person, not a condition. And as a reflexologist, we would be working with that person. It's very holistic. It's aiming to facilitate rebalancing of the whole person, not just of a part. And it allows reflexology, because it's an hour-long appointment. Generally, you can get shorter appointments, but generally it's an hour-long appointment. It allows for therapeutic touch. It allows for time. And in our busy lives, time is something that is rare, and we have to make an effort to take time out for ourselves. And it also involves empathic listening. Our therapists are very, as you can imagine, are very empathic, but they also have the ability to listen if somebody wants to talk. Many people don't. Lots of people just go to sleep and find it very relaxing. But some people actually need to talk, and they need to have somebody just listen to them, because that's all we can do. We're not counsellors, we just listen. And that can be really helpful. And just to remind you from the slide before, I wanted to put this in here because affective touch is believed, there is a piece of research on this, is believed to reduce the feelings of social exclusion and modulate pain. And I want you to think about your patients, my clients. How many of them, especially if they've got long-term chronic illnesses, may well be feeling socially excluded? And so reflexology with some touch and some time can really help with that social exclusion feeling, according to the research on affective touch. So uses and benefits. As I said, reflexology is holistic. It treats the whole person and not specific to one condition. The very nature of this means that because it's not condition limited, it's used across many areas where your patients, my clients, are feeling stressed, anxious, in pain, need to boost their quality of life, need to boost their well-being. It's very sort of open-ended. Its uses are open-ended, but that doesn't necessarily mean that it doesn't have value. It's rather more that it's very heterogeneous too. So analysis tends to be research and analysis tends to be very focused and doesn't capture the whole picture of a whole reflexology treatment often. And what we always say is that the best way to know whether reflexology will help a specific individual is for them to try it, because sometimes there can be quite surprising results from reflexology, and I hear stories of this all along, and you're going to hear some case studies in a little bit. So its uses with conventional medicine. Well, obviously, it was categorized as a complementary therapy, so one that could be used alongside conventional medicine. However, in the world that we live in, it is mainly privately practiced. So your patients, our clients, would need to pay for themselves to go and see a reflexologist. There's not a great deal of NHS interface in this. However, except for one place, And the place where it does interface with the NHS is in cancer units. So it's often offered as part of the complementary therapy offer within cancer units, especially the big ones, for example, Guy's and St Thomas's, the ones with Maggie's units, or Macmillan provided cancer complementary therapy support. And in these cases, the reflexology is there to support the individual and increase their quality of life measure. This is the research that's coming out. It's all about quality of life, and they're finding that reflexology really helps with quality of life through people that are going through cancer treatment. There was a piece of research from some time ago that showed that 62% of cancer units, from 2012 in fact, 62% of cancer units actually offered reflexology. My best guess would be that it's much, much higher than that now. There was also another piece of research that was asking people about the quality of how they felt their reflexology affected them. And one person said it was the only non-interventional touch I'd had all week. And I think that's a very important thing to remember, that reflexology is there as a support mechanism, as opposed to actually trying to do something specific. It also seems to help reduce symptoms such as pain and nausea within this group as well. So again, you know, big picture, if you've got somebody who has cancer, they might have pain and nausea, but you might have other people within your patient base that have pain and nausea as well, and they might find reflexology is really helpful for them. So I just wanted to put a little bit of evidence in here. There is a body of scientific evidence. It's not huge. Reflexology isn't funded by drugs companies or anything like that, so there isn't the money behind it to do the research, but that's definitely showing benefits of reflexology. However, we are, as therapists, we are overseen by the Advertising Standards Authority, so we are extremely limited with the claims that we can actually make. And those limited claims are that it relaxes, it reduces tension, it improves well-being, it helps sleep, and it there's one more and I can't remember what it is, which is really embarrassing, but there are basically 5 claims that we can make, and they're all slightly wishy-washy, and that is controlled by the Advertising Standards Authority, and we have no ability to change that. So it's very limited with what you will see in people's advertising. This, again, this lack of specificity does not necessarily mean that reflexology is without value, but it's that heterogeneous thing. It's across so many different things. So it's very difficult to get it labelled as a benefit for specific conditions. And again, the best way to know whether reflexology is going to help with your specific situation or your patient's specific situation is for them to try it. So just a few case studies. These are actually my clients. The first one, highly stressed female trying to get pregnant. Actually, I've seen lots of clients like this. Stress is incredibly anti-reproductive, and by reducing stress levels, by having regular reflexology, many of my clients have fallen pregnant quite naturally without needing to recourse to the very much more expensive IVF. It might not work, in which case then you can go down the IVF route, but it might be worth giving it a try in the first instance. I have an older female who has had cancer treatment, and she's got chemotherapy-induced peripheral neuropathy. Now, she comes to see me fairly regularly, but when she comes, she finds that her blocks of wood of feet, which is how she describes them, comes back to life. She has tingling, she knows where her feet are again. This is this proprioception thing, and she finds that for some period of time afterwards that she is able to walk an awful lot easier, and obviously that impacts on her safety, which is a really, really important thing for anybody with peripheral neuropathy of the feet. I have a younger lady who I saw many years ago who had recurrent migraines. I know you've heard migraines from other people, as from other therapies as well. And she had recurrent migraines such as she was taking 3 days a week off work, and work said, you've got to do something about this. She came to the clinic where I was working at the time, and she tried all the other therapies. Nothing worked for her. She came to see me. She had a couple of reflexology treatments and has never had a migraine since. She comes to see me now infrequently, but maybe a few times a year, and she still has not had any migraines. So whatever reflexology did to help her really made a difference. And of course, that changed her working life, because now she's in work 5 days a week. And this is my most recent little case study, recent new client, in fact. So I saw a baby only a few weeks ago. I went to see his mum and dad at home, and they'd had a terrible night's sleep because the baby had been crying all night, knees pulled up to his stomach in pain. And when I went there, I treated the mum. The baby then had woken up because the baby had been napping. And I just said, shall I treat the baby for a few minutes? It was no more than 5 minutes. I just gave some very light moves on the base of the baby's feet. And then I went to treat the dad. And by the time I left, 15 minutes after I left, I got a text message saying the baby had a great big poo and felt so much better for it. And I'm sure we can all relate to that sometimes. Reflexology is cradle to end of life care. It's available for everybody. So in summary, reflexology, it's a touch therapy applied to the feet or hands or face or ears. It aims to relax the body. It aims to rebalance the body probably through those pathways of interoception and proprioception. And it's all about restoring health and well-being. It's primarily provided by private therapists, although the NHS is using it, has embraced it, in fact, with cancer care. It can be received by most patients from tiny babies all the way up to end-of-life care. There are occasional situations when it's perhaps not the best idea to have it, and your well-trained reflexologist will know that. How to find a well-trained reflexologist? Well, you need to look for a reputable organisation. My organisation is an example of that, which is the Association of Reflexologists. We have a Find a Reflexologist search on our website, so you can just pop in a patient's postcode, and they can find people around them. It's always a good idea for them to have a good chat with the therapist before they decide to sign up for a treatment, because it's a therapeutic relationship. You need to actually like the therapist before you go. And also, as AOR members, we are actually able to be listed on the NHS website. It's under R and under reflexology services on the NHS website. So again, if you're looking for somebody for a patient, you might want to just go and have a look on there. It's under more NHS services, and then it's under R, and then it's under reflexology services. And all of our members are able to be listed on there. They aren't currently at the moment, but we're working on it. So that's the summary, and that's my I don't know if you can see this, that's my logo there for our organisation, the Association of Reflexologists. Yeah, I hope you've enjoyed this whistle-stop tour of reflexology. Thank you.